Hello everyone, welcome back to Yaznexaspark. Let's heal and learn together from SNS College of Nursing. I'm your Yalini, and today we are going to see about an important topic from the unit of sensory organs, the minus of eye. At the end of the class, you will be able to analyze the what is of eye and the functions and also the clinical applications. Let's go into the topic. All know We all know that the eye is spherical in shapes and it's also about a 2.5 centimeter in diameter. It acts the vision of organs and supplies in the optic nerve, which is of second nerve. The eye works like a camera. It captures light and focuses it and sends visual information to the brain. In nursing, we assess the visual acuity for the retinas, discharge and trauma and to educate the patients on the eye protection. Any damages to can or to eye can lead to partial or complete vision loss. So anatomical knowledge is very important. Inflammation of these layers, which is of the layer of eye, can lead to the condition like scleritis, uveitis, and retinal detachment. So, nurses must observe for the pain, brightness, and sudden vision changes and report this to immediately. Outer fibrous layer, which is of contains the sclera. The sclera is a white part of the eye. The cornea is a transplant of the front part. The sclera gives the shapes and directions, and while cornea allows the light to enter and helps in focusing. The middle vascular layer, which include the choroid and ciliary bodies and iris, this layer provides nutrition and control light entry, and the inner nervous layer, the retina, which actually detects lights and convert it into the nerve signals. This helps the controls the amount of light entering the eye, just like apertures of the camera. In clinical practices, we check pupil size and react to the light, and also which called as PERRLA during the neurological assessment. Fixed or unequal pupils can also indicates the serious conditions like head injury or increased intracranial pressure. The eye has the atrioorbital muscles, which helps in the up, down, side to side, and rotations. And these all are supplied by the cranial nerves, which is of third and fourth and sixth. And also, the weakness or the paralysis of these muscles can causes the double vision, and also the squeletus. And in nursing, we can say that the mainly the document always if the patient's complains of the pain in the eye, we should be more as so because the movement in the eye with a stroke also differs, and neck injury and the thyroid eye disorders is also differs. So we have to always prioritize the we have to check the movement of the eye. Retina is the inner lining of the eye. The retina is the inner lining, which is of the innermost dedicated layer of the eye. It contains of the 10 layers of the nerve cells and also two important phototherapy receptors, which is of rods, which is responsible of the vision in the dim light and of the peripheral vision, and cones, which is responsible for the color detection. Yes, we have different colors in and around of us. The each color is different. We can, for example, we'll be saying the red, the pink, because these are gives a color, and the sharp central vision, which is the responsibility of tone. The retina converts the light into the electrical impulses and also the travels into the other optic nerve to the brain. Damage to the retina, as a diabetic retinopathy or hypertension or retinal detachment, can cause a permanent vision loss. As a nurses, we should screen the hypertension and diabetic patients very sensitively because teach them about the regular eye checkups so that they will be preventing the permanent eye vision loss of the patient. The layers are visualized here. Any patients with a sudden vision loss and severe eye pain or abnormal pupil reaction need the urgent medical attention. Here is a mind map which summarizes the entire structure of the eye and the layers and the pupils and the retina and the photoreceptors. The main two photoreceptors are cones and rods. And we have seen the anatomical structures and functions of protection and the vision. And nurses important is of accurate assessment. That is of PERRLA and early detection and the patient safety is important. These are the mind map. You can keep a note in it. References. That's all for today's quick and clear section of the section of eye. If this video is helpful for you in your nursing studies, do like, subscribe and share you to your nurses students, and also subscribe to the Yaznexaspark for the most simple and easier way for exam oriented anatomical and physiological video. Drop your comments here so that next video what your topic you want. Thank you once again. Bye bye. See you in the next video.